Good afternoon. Welcome to the Committee on Health and Human Services. Secretary, will you please call the roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Wynn, Ornlicker, Chair Brown May.
Here. Thank you. We have all members present and accounted for. Some housekeeping items as we begin our meeting today. As a reminder, please silence your electronic devices. If you wish to testify, sign in at the table by the door and provide a business card to our secretaries. And then when testifying, remember to turn on the microphone and then clearly state and spell your name and then any affiliation that you have. Members of the public may provide public comment and testimony on a bill by person or in telephone. To do so, dial 888-475-4499, and then when prompted, present the meeting ID. Today is 823-008-03315, and then press the pound sign. That information, committee agenda and information is available on Nellis as well as our YouTube channel. Today we'll take public comment at the end of our meeting. And as a reminder, please be courteous and respectful in all of our interactions. We have a number of items on our agenda today. Given that all of our members are present and accounted for, we will begin with a work session before we move into the bills on our agenda. So it's not customary for the committee to take testimony or otherwise rehear bills during a work session. However, I may invite a witness to come forward for clarification if it's necessary. We will start today with Senate Bill 138, and I will turn this over to Mr. Florence.
Thank you, Madam Chair. Davis Florence, Committee Policy Analyst for the record. Just before I begin, I'd like to remind the committee and public that as nonpartisan Legislative Council Bureau staff, I can neither support nor oppose any measure before the committee today. The first bill is Senate Bill 138 in its first reprint, and it makes revisions governing health care for pregnant women and newborn children. This was sponsored by Senator Cannizzaro and was heard on April 30th. There was an amendment submitted by Senator Cannizzaro, which is attached and proposes to authorize a vendor that a hospital has contracted with for the purpose of performing presumptive eligibility screenings to conduct such screening duties in the same manner as qualified hospital staff. Second, it allows a hospital to provide information regarding benefits from the Supplemental Security Income Program and Medicaid to a parent or guardian verbally if the information is unavailable in their native language. Third, it clarifies that information on submitting an application to enroll in Medicaid does not need to be provided to pregnant women who are already enrolled in Medicaid. And finally, add Assembly members Brown May, Gonzalez, Gray, Nadeem, Wynn, and Ornlicker as co-sponsors. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions? Seeing none, I will entertain a motion to amend and do pass. Motion by Vice Chair Wynn. Second by Assemblymember Gonzalez. Thank you. Is there any discussion on the motion? All those in favor say aye. Aye. Any opposed, nay? Nay. We have one nay from Assemblymember Hafen. Seeing that, the motion carries. And I will assign that floor statement to Assemblymember Gonzalez. Thank you. Next on our agenda, we have Senate Bill 188. And I will turn this over to Mr. Florence.
Thank you, Chair. Davis Florence for the record. Senate Bill 188 in its first reprint establishes procedures to assist certain persons with limited English proficiency in accessing health care in certain circumstances. This was sponsored by Senator Doñate and was heard on April 28th. There was an amendment submitted by Senator Doñate, which is attached and proposes to remove the punishment of being guilty of unprofessional conduct and instead state that a provider of healthcare who violates the provisions of sections 15 through 20 may be subject to disciplinary action by the board, agency, or other entity by which they are licensed, certified, or regulated. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. So moved. Motion by Vice Chair Wynn, second by Assemblymember Hunt. Members, is there any discussion on this motion? Discussion. Go ahead, Mr. Koenig.
I'm going to vote yes to get this out of committee, but I'd like to hold my right. What's that? Reserve my right. Thank you.
Thank you, Assemblymember. Any other?
Thank you, Chair. while I am hopeful to get to yes by the time we get to floor, I'm going to be a no in committee. Thank you.
Thank you, Assemblymember Hibbets. Seeing no other discussion, Assemblymember Gray.
Yes, ma'am. I'm going to vote yes as well to get it out and then reserve my right. Thanks.
Thank you. Okay. Any other discussion? Seeing no other discussion, all those in favor say aye. Aye. Any opposed say nay. Nay. Okay, if you will raise your hands. Thank you. Nay from Assemblymember Haven and Assemblymember Hibbets. Motion does carry. Thank you. I will assign that floor statement to Vice Chair Nguyen.
Thank you, Chair.
Thank you. Next on our agenda is Senate Bill 349. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Senate Bill 349, it's in its first reprint, revises provisions relating to anatomical gifts. This was sponsored by Senator Pizzina and was heard on April 23rd. Senator Pizzina proposed an amendment to add Assembly members Dahlia, Gonzalez, Jackson, Nguyen, Edgeworth, and Gray as co-sponsors. Thank you, Chair.
Thank you. Members, is there any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Assemblymember Gray. Is there a second? Second by Assemblymember Dahlia. Members, is there any discussion? Seeing none, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously, and I will give that floor statement to Assemblymember Gray. Really? Okay. Okay. Thank you. Okay, that concludes our work session for today. Thank you so much. We do have a number of members that will be in and out. Thank you, Ms. Assemblymember Jackson. That was a very quick exit. Okay, that moves us to the items on our agenda. Okay, we will officially open the bill hearing for Senate Bill 306, and we will welcome our presenters forward. Thank you so much. As we begin today, I want to just discuss a little bit of the lay of the land. We do have 3 bills on our agenda. We want to make sure that we give due time to everyone, and we do have a number of members moving in and out of committee. So we will ask each of our presenters to limit their presentation to no longer than 15 minutes, please, for your bill presentation. And then when we move into public comment today, we will stay with 20 minutes in support, 20 minutes in opposition, and 20 minutes in neutral. Our goal is to go 10 minutes here in Carson City, 10 minutes in Las Vegas, and then 10 minutes on the telephone. And then we will continue until all of our time is used. But again, 30 minutes in support, 30 minutes in opposition, and 30 minutes in neutral on each of the measures that we will consider today. We will welcome Assemblymember Mosca and team to the table. Thank you so much for being here. You may begin whenever you're ready.
Thank you so much, Chair Brown-May, Vice Chair Nguyen, and members of the Committee on Health and Human Services. My name is Erica Mosca, and I represent Assembly District 14 in East Las Vegas. As a co-sponsor on the bill, Senator Cruz Crawford presented it on the Senate side, so I am excited to be here on the Assembly side today. So that's why you see me. I want to first acknowledge and thank the tireless work of SEIU 1107 for over a year with multiple constituency groups and their partners. They have worked on this policy here today. It, 1, solves a current problem in our children's mental health system, and 2, lays the foundation for the important work that needs to continue so that we can make sure we have an adequate, appropriate, and effective continuum of care for our Nevada children who depend on us for their care. I'm here today as someone with both personal and professional experience. As a former educator, an education nonprofit founder and executive director, professionally, I saw firsthand the impact of inadequate mental health systems and the direct consequences to students and families. The hardest thing I've ever done is to help a family make funeral arrangements and support them through their loss of their son by suicide. This is an issue our legislature must address. Personally, in the past year, as a foster parent, I have got to know and care for amazing, bright, and potential-filled young people in our community who I know could thrive. I've been a child haven in Clark County many times. I have seen the tireless work of staff members. However, a temporary shelter is not a clinical setting. This bill ensures that our children who need the most support, those diagnosed with an emotional disturbance and/or severely emotional disturbance, have a plan to ensure the appropriate level of care based on their needs, and that the plan will be executed with an appropriate time frame. And that is the very small amendment. It's about a sentence that's on Nellis today. We add the and/or severely emotional disturbance to emotional disturbance because that's actually the correct definition. And I will note for the committee that this bill passed unanimously in the Senate. And I will now pass it to my co-presenters here who will share one, specific examples of what's happening in our state today, and two, a walkthrough of the bill. So I thank you, Chair and committee members, for considering this today.
Thank you so much. Good afternoon, Chair Brown May and Vice Chair Nguyen, and members of the Health and Human Services Committee. My name is Michelle Maese, Michellemaese, and I'm the president of SEIU Local 1107, and a 17-year employee of Clark County Family Services, a supervisor for the specialized unit which focuses on child fatality and sex abuse and near fatality. I want to thank Senator Cruz Crawford, who just joined us today, as a sponsor of this bill, and co-sponsor Assemblymember Mosca for sponsoring SB 306, which will address the need for the appropriate placement and treatment and discharge of our Nevada children in need of mental health services. Also, I want to thank our Family Services SEIU members who came up today to testify in this bill, and our political director, our lobbyists, our executive directors, Clark County Mental Health Office Director Moreno, and Assistant Director Rodriguez, and Chief DA Duffy, and the 3,500 kids in foster care and the children in Nevada who might need mental health treatment. They didn't choose this path, and so I want to thank them for being patient with us as adults as we work together to find a solution for appropriate placements for their mental health treatment. I also want to emphasize that this bill is referencing all Nevada children, whether they are with their parents, their guardians, relatives, or in foster care or adopted. This policy currently in the state of Nevada, Nevada temporary shelters are the only placements who follow the policy of no reject, no eject. If a child's care provider can't meet their mental health needs, the temporary shelter cannot reject a child from coming into their shelter because of those mental health needs. And once a child is placed in the shelter, they can't eject a child for any reason. Hence the term no reject, no eject. Now I'm going to turn it over to my SEIU sister, Nicole Miller, who has been with Family Services for over 20 years, and she's going to walk you through some examples of what it's like to be on campus every day. Thank you.
Good afternoon, Chair, Vice Chair, and members of the committee. Thank you for hearing our bill today. My name is Nicole Miller, Nicolemiller. I am a 20-year member of SEIU and have worked for Clark County Family Services for 20-plus years. I work 5 days a week with our abused and neglected children, youth, and teens at Child Haven campus. Child Haven is an emergency shelter for abused and neglected children ages 0 to 18. The shelter is designed to be a safe, temporary place for children that have nowhere else to go due to being removed from an unsafe home environment. Child Haven is licensed as a daycare center, not a mental health facility. The difference between temporary emergency shelters and residential treatment facility is that the residential treatment facility is designed to provide acute mental health services to children in need of stabilization with medication, individual, and/or group therapy. Once acute treatment is established, the child can be released with a treatment plan for ongoing services in order to meet their daily needs. Our temporary shelter, such as Child Haven, can't provide the services children need for stabilization and mental health care. When children arrive at our temporary emergency shelters, we are unable to diagnose and manage their ongoing mental health issues. Children are being disrupted from foster homes and dropped off at temporary emergency shelters because their mental health needs can't be met safely in the home. When ongoing medication management and psychiatric care needs aren't established and ongoing, there is a gap in care until they are placed in a treatment facility and stabilized. We had a child transported to our temporary emergency shelter by paramedics on a gurney, strapped down due to violent tendencies. For this story, I will identify this child as Richard. Richard was 11 years old, and he was approximately 5'3" and 200 pounds. He was diagnosed with mental health issues, and he was autistic. He was nonverbal and in diapers, and due to his physical aggression, his mom could no longer care for him. She refused to pick him up from the hospital upon discharge and he was transported to Child Haven. Richard was dysregulated and violent. He attacked staff and other children, if in his way. He was so upset at one point he charged a male staff. They fell through a glass window. Both Richard and our staff, who was a union member, ended up at the hospital, and Richard came right back to our temporary emergency shelter. Richard needed one-on-one care, thus taking the care from our other children that are abused and neglected. They were all impacted by this and induced secondary trauma. Richard's needs could have been better met in the residential treatment facility as opposed to our emergency temporary shelter. This is just one story out of many that we deal with on a daily basis. Thank you.
Thank you, and we're going to go to our Chief DA, Bridget Duffy, in Las Vegas.
Good afternoon, Chair and members of the Assembly Health and Human Services Committee. I am Bridget Duffy, BRIGID, DUFFY. I'm actually the Assistant District Attorney over the Juvenile Division. I'm very proud of my title in Clark County, Nevada. I run the Juvenile Division, which is over the delinquency, which are children that commit delinquent acts or what most people would call crimes, and also over our foster care system and children are abused and neglected. It is my first job today to walk you through Senate Bill 306. So I'm going to start by outlining to you the portions of the bill. Section 3 would amend Chapter 433B, which is our children mental health statutes, to read a new section that would require public and private inpatient psychiatric facilities to ensure that we have appropriate discharge planning. That's my summary of that section. It would require that the court approve discharge plans for a child. If a parent or guardian of the child does not approve of that plan, it would prohibit discharging the child to a temporary facility, and it would require the approval by an agency which provides child welfare services before receiving the child after discharge. This section of the bill would hopefully prevent these placements that are occurring, which we know are not appropriate for children who are coming from a high-level needs facility and stepping down into basically a place that has no treatment at all, or back home to families who don't have the wraparound services in place ready yet that they need. So it would help to ensure that before children are sent out of a residential, which again is a high-level needs placement, that the services are in place to ensure that they have the treatment in the community. Section 3.5 amends 433B 130, again, our children's mental health statute, that would be requiring upon an order of the juvenile court pursuant to any of the juvenile delinquency disposition hearings or sentencing hearings, or under 432B of the NRS, which is our child abuse and neglect proceedings in civil family court, that if a child is ordered to a residential treatment facility for services, that would have to occur within 30 days after receipt of the order. So currently we have children that are in need of residential placement that are waiting upwards of 4 months to get that residential placement. So this bill, if passed, would require that they be placed no later than 30 days after receipt of that order. Section 4 then has conforming changes within NRS 433B. So that concludes my walkthrough, and I think at this time we'd be happy to have any questions you have.
Thank you, Chair. We are ready for questions.
Thank you. Members, questions? Assemblymember Hibbets.
Thank you, Chair. I have two questions, if I may, and the first one is just a clarifying question on the conceptual amendment. It says the amendment is to Section 1, subsection 3. However, according to the bill, Section 1 was deleted by amendment. So I just want to clarify it's actually meant to fit into Section 3 where it has the public-private inpatient psychiatric thing.
Erica Mosca for the record. Yes, thank you, Assemblymember Hibbets. It should be Section 3, the one that has the emotional disturbance. Yes, thank you.
Thank you. And then my second question is, under 3.5, where it says the facility has no later than 30 days after receipt of the order, if children are currently waiting 4 months, where are we going to find beds to put them in 30 days?
Bridget Duffy for the record. Assemblymember Hibbets, I think that's a really great question, and actually goes toward my ultimate, what will get to my support of this bill for the Nevada District Attorneys Association. The state will need to find those beds. And right now, I think I've been known for my honesty throughout my 5-6 sessions with you all. Courts are ordering things to happen within certain timelines. And when they don't happen, they'll give a continuance and they'll say, come back in 30 days, or they'll say, come back in 45 days. And miraculously, things happen on the day before the day that it's up, if you all can understand that. So I think by putting a timeline in here and holding accountability to what we need for children in our state will make things happen for them, and the beds will be there because they have to be there.
Thank you very much, and thank you, Chair.
Thank you. Next question from Assemblymember Goulding.
Thank you, Chair. My question is along the same line of thinking of what happens when there's not available capacity. And I think that's perhaps wishful thinking, the statement that you just made. If there's not capacity, there's not capacity. And so that seems to be an underlying issue. My question is, are children ever transferred to out-of-state facilities in a desperate effort to find an appropriate facility?
Bridget Duffy for the record. Yes, we do have children that are placed outside of the state in order to receive treatment because the beds are not available within our state.
And Chair, if I may, Erica Masio for the record. And Assembly Member, that's a great question. And for me, that's why I said in my second remark, really it's about laying the foundation, because right now we may not even know how many. I think we do take that record, but we don't know, is it because it's not in a timeline? Is it a timeline? Are there places who can take them? So to me, we know that our continuum of care in general needs more work, and this to me is a foundational work start that can also begin that important work.
Thank you. So that so is what you're saying that it's not clear right now if it's a capacity issue or a process issue, and that this will help clarify which one of those need to be worked on?
Erica Masio for the record, I would say that, but I would also let my co-presenters share.
Michelle, may I say for the record, we'll go to Alexa Rodriguez, who's in Las Vegas.
Good afternoon. Alexa, Alexa Rodriguez, Rodriguez, with the Clark County Office of Clinical and Community Services. Can the question please be repeated?
Sure. I guess what I'm looking for is clarity. And Assemblywoman Mosca, you said that perhaps that this bill provides an opportunity to clarify if it's a capacity issue that we're dealing with or a process issue. And I'm wondering if I'm understanding correctly that that's one of the objectives of this bill, is to figure out what the problem is.
Thank you. Through Madam Chair, I believe it's both. It's a capacity and a process issue because we have kids lingering in both detention centers and our shelters that are recommended for this level of treatment, and they are sitting for months and months in these settings without getting the level of care that they need. So I would say both. Thank you.
Thank you. Next question we have from Assemblymember Gonzalez.
Thank you so much. So I don't work in this area, so I was just getting some clarification. So what is happening to kids now, and is the bill just saying that you need to have a documented plan? Like, I guess I'm just really confused on the slideshow and kind of the testimony today.
Bridget Duffy for the record. I can give an example of what's happening to kids today. Just a week or two ago, we had a young man, a child who was in a facility. And in fact, I believe you may have heard from his family on Senate Bill 372 last week, who was in need of treatment. And when he was ready to be discharged, although there were 2 state agencies involved in his life, both youth parole and children's mental health services, the plan became to release him to a temporary shelter for abused and neglected children because his parents could not handle him at home, because he'd be stepping down from a facility back home without the appropriate services wrapped around him. So this bill is in conjunction with SB 372 to ensure that appropriate planning is made with parents understanding what the plan is, making sure that kids have those plans in place. The state pays a lot of money to treat children in these high-level needs homes, only for it to unravel as soon as they go into these inappropriate placements. So to have some level of accountability and ensure that appropriate discharge planning is in place is what that Section 3 is all about. And if we can't all agree on it, especially in a case where the state is already involved, the judiciary is already involved, make sure that we have somebody like a juvenile court judge over the proceedings that can say this is what is appropriate for this child. So it's not just, hey, this kid needs to be picked up, come get him, and the parent saying, like, what are we expected to do? We've been down this path before. This child's been in 10, 15, 20 facilities and stepped right back home, but there are no services in my home to ensure that I have the ability to care for my child, that my child has the services they need to regulate themselves in a way that is healthy. Just pick them up is not enough without proper communication. And we should know far enough in advance to know when those discharges are happening. So every week we have these examples, and I'm emailing and calling, and it's odd because the DA's office is involved, but it's because we're involved because we care about outcomes for kids. Whether they're kids who have committed a violent act of a battery or just an abuse and neglect or combination of both, we want what's best for them because we want them to succeed and be really, good, successful adults. So I get the call and they're saying they want us to pick up these kids, but we have no idea is the therapist going to meet with this child at home? Are services going into the home? It's a free-for-all. So this bill would at least have some measure of what expectations families and county agencies can have when children are stepping out of either private or public facilities. Thank you for the opportunity to answer that very important question.
And Chair, if we could go to Ms. Mayesi next.
Thank you, and through you, Madam Chair, to Assemblymember Gonzalez. Also, I just want to recap on the bill, and thank you for the question. SB 306, and I just put another slide up there, it guarantees that all Nevada children who need mental health treatment will receive care that they need by ensuring they're placed in the proper facilities. Okay, because right now they're just being dropped off at Child Haven campus, and it's a temporary shelter. It's licensed as a daycare center. And then SB 306 will restore working conditions at Child Haven and other temporary shelters by reducing the number of kids in those shelters. This will also allow staff to provide appropriate care when kids are abused and neglected are placed there. And then it will also guarantee that our Nevada children receive appropriate mental care that they're used to, like Ms. Duffy said. But the bill also will give the facilities the ability to work together on placements, so it's just not one person working on it. We're working together in partnership to make sure that there's a discharge plan and requiring the approval of a discharge plan before the kids are asked to leave the facility or graduated from the facility. Thank you.
Thank you so much, and Chair, thank you for the follow-up. So in section 3, number 1, when it says require a court to approve the plan, so are these all justice involved children? If a child is not involved, does that mean a court gets involved? Can you clarify that?
Bridget Duffy for the record. So they would not necessarily be all justice involved. They could be children that are just foster involved. So children that have been abused or neglected that are in residential treatment facilities and are stepping out of those facilities. They could be justice involved, or they could be both. So we have children that are in foster care that also are in the juvenile justice system. So there could be a combination. With regard to children who are not yet court involved, these cases usually involve parents who ultimately will not pick their children up from the residential treatment facility because the discharge plan does not assist them in understanding what's next. And so they become involved with the court system through the child welfare agency, because once they are abandoned, so abandoned would be the neglect term, out of residential treatment facility with no adult to pick them up, that automatically generates an abuse and neglect case and court involvement.
Thank you. And my last question, thank you so much, Chair, for the indulgence. So what happens in a case work? So we're talking about multiple people creating this case plan. In that event, what happens when the parent or guardian doesn't agree or feels that the plan that they've been given is not sufficient enough or doesn't go far enough, or they are looking for other recommendations or resources? What happens in that situation?
I will take that one again, Bridget Duffy for the record. In that situation, if it's just parent and the facility, that would then generate the report to the child welfare agency, and then the child welfare agency would get involved with the court system in order to find the appropriate placement for the child. But this would rule out a temporary facility as that appropriate placement.
Thank you. Members, any other questions? Okay, seeing none, we'll say thank you very much for your presentation. If you will step back, we will open up testimony in support. If you would like to offer testimony in support, Senate Bill 306, please come forward at this time. Again, we will ask you to state and spell your name for the record, keep your comments at 2 minutes, and then we will be staying within our 20-minute time limit, 20, 20, and 20. You may begin whenever you're ready.
Good afternoon, Chair and members of the committee. For the record, my name is Alex Noriega, representing the Nevada State AFL-CIO. We represent 120 unions with over 150,000 members, and we stand in full solidarity with SEIU 1107 and urge the committee to support this bill. Thank you.
Good afternoon, Chair Brown May and members of the committee. Joanna Jacob, JACOB, on behalf of Clark County. I'm here in support of the bill, and I just wanted to echo on my testimony last week, and there was a reference to the bill. And I agree with the comments from Ms. Duffy or Ms. Mays, I can't remember who said it, that those two bills do work together, and that these are the concerns. On behalf of Clark County, and especially because I have been on Child Haven tours with Ms. Miller, who testified here today, and we really are concerned about the discharges to the temporary facility and the impacts to my Clark County fellow employees, and our county personnel who are there 24/7, as I mentioned last week, and this is really a step towards the right direction to finding an appropriate plan for the care of this very vulnerable population that we're talking about. So we are in support, and we look forward to working with this committee on this bill and on the other bill that was mentioned and moving it forward. Thank you.
For the record, my name is Mark Ellis, President, Communication Workers of America, Local 9413. We support.
Good afternoon, Chair and members of the committee. My name is Leah Hawkins, Layahawkins, and I'm a 9-year member of SEIU. I work for the Department of Family Service on the Child Haven campus, and I'm testifying in favor today of SB 306. In my experience with working with youth with mental and behavioral health issues, I've witnessed youth being turned away from the psychiatric facilities, regardless of meeting their criteria, being in crisis, or being deemed acute. The youth have been in the system. Youth that have been in the system for many years are often turned away because of their reputation of difficult behaviors, or simply because their Medicaid just runs out. We've even had a few kids who are banned from the facilities. As a result, our youth begin to treat themselves, and this looks like excessive drug use, alcohol use, fighting, running away from the shelter, sex traffic recruitment, and even sexualized behaviors. These youth then become disruptive, violent, attacking staff and other youth. This re-traumatizes the youth that reside on the Child Haven campus, and our temporary shelter is a licensed daycare facility. We don't have the resources or the services to support youth of this population. I ask Chair and members of the committee to please vote in favor of SB 306. Thank you.
Good afternoon, Chair Brown May, members of the committee. For the record, my name is Cadence Matijevich, Cadencematijevich, representing Washoe County. And I, too, am here in support of SB 306 and would follow on from the comments from my counterpart from Clark County, Ms. Jacob, and also from Ms. Duffy, and repeat again, because I think it's worth repeating some things that I said to this committee in a bill hearing last week. Child welfare agencies are meant to protect kids from adults, not kids from other kids. And while this is a very vulnerable population of kids, emergency shelters for child welfare agencies are not the appropriate placement for them. This is a piece of a broader conversation that we need to have in this state about having sufficient resources for kids who are in behavioral health crisis. But the right place for them is not in our temporary emergency shelters. And so for that reason, we would ask that you support this bill. Thank you.
Hello, Assembly Member Brown May and excuse me, the rest of the board. My name is Mackenzie Lee. I'm a dedicated senior family services specialist on Child Haven campus with 25 years of experience in foster care and mental health, 20 years in adolescent care, temporary shelters, residential treatment centers, and acute mental health. Acute inpatient stays are 5 to 7 days to stabilize medication. Upon release, children are returned to the community without their mental health needs being met. Upon their release, aftercare services are inconsistent, which the child regresses and current traumas increase as they are returned to their original setting that caused the initial issues for hospitalization. The inadequate care increases traumas, the unmet needs, and ongoing issues that cause them to be placed on a DNA list, which is do not admit list. All local mental health facilities work with one another, denying the child's mental health needs. The passing of SB 306 is vital in providing adequate care of the adolescent in our community. Addressing the needs of the SB 306 allows the youth battling mental health illnesses to live a prosperous life and be productive members in our society.
Good afternoon, Chair Brown May, Vice Chair Nguyen, members of the committee, Kayla Maese, K-A-Y-L-A-H-M-A-E-S-E, the other Maese in the committee room today. The ACLU of Nevada supports SB 306, and we encourage the committee to support as well. Thank you.
Good afternoon, Chair and members of the committee. My name is Robin Franklin. That's R-O-B-I-N, Franklin, F-R-A-N-K-L-I-N. I am a 19-year SEIU member and a family services supervisor for Clark County Family Services. I work at the North Site. I want to thank the Senator Crawford and Assemblywoman Cruz for sponsoring this important legislation. I am testifying in support of SB 306 because every child deserves a haven, a safe place. Every child deserves to receive the services that addresses their mental health needs. Our state and community partners are not living up to this idea. Based on today's current practices, hospitals, treatment centers, and the like are able to deny entry or discharge children without a plan to temporary shelters. These caregivers do not have a license or training to maintain children who are deemed acute. the behaviors that are out of control and a danger to others. There are temporary shelters that house the maltreated, neglected, and abused children of our state, and when mental health treatment providers discharge these children, they set them up for further traumatization. Staffs are brutalized, and children need services. The children that need services, they spiral out of control. SB 306 would ensure that treatment providers are held accountable in the community's effort to supporting youth's mental health needs and discharging children to the most appropriate placement setting. It is all of our responsibility as a community. Having worked on campus both as a full-time and a part-time worker, I've seen the negative impact untreated mental health has on other children and the staff. And the child in question, they attack indiscriminately, both staff and other children, vandalize the shelter, leave premises without the permission, and don't have a safe place to go. If this is the standard of our care by our community, we need to do better. We have a unique opportunity to help our most vulnerable population, so in the words of Spike Lee, please do the right thing.
Good afternoon. My name is Casey Stimson, CASEY-STIMPSON. I am a 19-year member of SEIU and a supervisor in specialized permanency for Clark County Family Services. I'm testifying in support of SB 306 to not only ensure the needs of children on our specialized caseloads, but for all children involved in the child welfare system. Specialized permanency serves children and families impacted by sexual abuse, child fatalities, near fatalities, commercially sexualized exploited children, and severe physical abuse to children 4 and under. Children on specialized caseloads have extensive medical, developmental, behavioral, and mental health needs. Their needs cannot be met in a temporary shelter. Their trauma experience and their mental health is best met when they are wrapped by trained, licensed professionals, not by placing them in temporary shelter situations. Children whose mental health is not properly addressed and are placed in temporary shelter situations frequently negatively impact the other children in the shelter. This is seen through acts of aggression, violence, perpetration, and solicitation. Our children deserve support, services, and treatment. They do not deserve to be passed on to the next temporary stop until their needs become acute again. I personally supervise 3 staff who provide after-hours on-call support to CCFS permanency in addition to their regular duties. It is commonplace for them to spend hours in emergency rooms with youth having mental health episodes, which have not been addressed appropriately and are pending treatment, but with no plan or place to go. This bill will help ensure our children's mental health needs are prioritized and met adequately. It further ensures the safety of all children in temporary shelter and provides support that is desperately needed to my peers who work in these shelters, such as Child Haven. Thank you.
Good afternoon, Chair and members of the committee. My name is Shalonda. That's Shalonda Adams, SHA''Londa''ADAMS. I have been with the Department of Family Services and SEIU for over 12 years, and I am a supervisor with Clark County Family Services. I ditto what everyone has said today, and I also want to add that children deserve ongoing mental, not momentary health. And I am in support of SB 306. Thank you.
Thank you, Madam Chair. Dan Musgrove, today, not on behalf of any client, but in my role as the Vice Chair of the Clark County Children's Mental Health Consortium. And let me just say this is an important bill. I was just looking back at emails that back in September of 2021, when we convened a group to focus on the issues that were happening at Child Haven. That group was led by former Speaker Barbara Buckley, and there was lots of folks there, from Director Whitley to folks with DCFS and DFS at the county level, and this has been a huge issue. And we know it's just not just Clark. Obviously, you heard from Washoe County as well. So we support this bill, and thank you. And it's just, it takes a long time to move the needle, and sometimes we just have to keep pushing. So thank you for your efforts today.
Oh, no, we're going to cross our fingers and hope that we don't have technology issues so we can keep going. Thank you so much for your testimony. We'll go down to Las Vegas. If you would like to offer testimony in support of this measure, you have 2 minutes. Go ahead and begin.
Good afternoon again, Chair and members of Assembly HHS. I am Bridget Duffy Still, and I am putting my support on the record on behalf of the Nevada District Attorneys Association. Mental Health America 2024 report has Nevada as 51st in the nation and territories for children's mental health. If that sounds familiar to you, it is because we have come in last as a state on other children's issues over the year, including education and collection of child support. Stakeholders from counties have met with state officials over and over to address the needs of our children in the state. Over the years, bills have been presented to this body and watered down, and I know you understand what that means. In a decade, we have made no meaningful progress to improve mental health resources for our children. So once again, myself and other advocates for children are aggressively coming to you, our trusted lawmakers, to ask you to take a stand for children and families. When you think of this bill, again, I say, think of it in conjunction with the bill you heard last week, SB 372, where you heard the pain that a family goes through to get help for children. Imagine a child with mental health needs sitting at a detention facility for months waiting for treatment. Treatment our state should be providing pursuant to NRS 433B. When I was told I had stage 4 cancer, I went out of my mind thinking about my family. I was told that the doctors on my insurance weren't taking new patients. It took me months to find a local oncologist. I had to leave the state for treatment because I knew every day I lost was a day I was closer to not being here for my kids. And I am an overeducated adult that can self-regulate my own behaviors. Imagine a child without a strong support system or strong adult supports that have exhausted everything, like you heard about last week. Every day a child isn't treated is a closer day to them taking their own lives or the lives of others, and I have seen it. And we, as the adults that care about these kids, are suffering every day we go home because we are seeing it every day, these kids that are untreated. Section 3.5 of this bill is reasonable. Waiting 30 days is reasonable for treatment in a facility. Imagine if it was your child or someone you care about. Without this deadline, children are waiting for months. In the adult system, deadlines were put on place to get adults with mental health treatment out of our local jails. And guess what happened? The state did it. They are meeting those needs because they were pushed to timeframes by our courts. We need to do better. And I know you are asked a lot during these sessions. Everyone has different priorities. But today you have before you people who are dedicating entire careers, 25 plus year careers, to lives of children in our state. This bill is about helping children who are sitting and suffering and waiting for appropriate treatment. And we cannot let them get stepped down into inappropriate treatment facilities because then we're just wasting Medicaid money. This is paying it forward, which I know we don't do a lot in government.
I'm going to interrupt you. I want to thank you.
I appreciate it. Thank you so much. Because I'm not going down without a fight, and I appreciate your time and attention to SB 306.
Thank you. I appreciate your very compelling testimony, and we appreciate that you're here and that you're offering testimony and a part of the presentation. To everyone who presented today, thank you for being here. And that's true for all of our presenters, and we're so grateful that the public is involved in all of the measures that we consider, not just this one. With that, we will now go to AVH. I don't see anyone else here in support in Las Vegas. AVH, is there anyone on the telephone line who would like to offer support of this measure?
If you would like to testify in support of Senate Bill 306, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 306, please press star 9 now.
Good afternoon, Chair and Committee. My name is Richmond Warnke, Warnke. I'm with SEIU. This bill is important to me, and I plan to be there in person today, but only calling in today because of being sick. Through my experience seeing these struggles mentioned of the unstable conditions for the vulnerable children, I challenging them firsthand, I want to highlight the critical need for providing mental health services for children. Capacity is a problem, but the process is more of the main issue. The process of leaving children who need mental health care in a temporary shelter without the correct care is a big part of the problem. Furthermore, mental health issues often begin in childhood, and when left untreated, they can often affect the child's ability to learn, grow, and thrive. Early intervention is key. By providing the right care at the right time, this can work towards preventing these struggles from becoming lifelong challenges. SB 306 is a step forward to the future of our children, families, and communities. Thank you so much for your time.
Good afternoon, Chair Brown, May, and members of the Assembly Health and Human Services Committee. My name is Caleb Cage, CAGE, and I'm here representing the Children's Advocacy Alliance today. CAA is an independent voice for Nevada's children with a mission to ensure all children in Nevada thrive. We are in strong support of SB 306 to address critical gaps in Nevada's children's mental health system. Right now, families in crisis are too often left navigating a broken system, being turned away from facilities or discharged without a plan. Senate Bill 306 sets clear, compassionate guardrails for some of the existing challenges we heard during the presentation and testimony for placement for youth in mental health facilities, and this bill is an essential solution for some of those challenges. Accessing inpatient care is the first step for supporting our children with navigating their mental health. That support must continue once the child is discharged to ensure they are set up with the opportunity to succeed when they are back with their family. A discharge plan is not guaranteed under the current law, but will be required through SB 306 and will greatly support the continuum of care for a youth mental health plan. This bill helps make our mental health system more accountable, more family-centered, and more responsive to the needs of vulnerable youth. We urge your support. Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Renee Ruiz, RENEE-RUIZ. I'm with National Nurses United, National Nurses Organizing Committee of Nevada. We represent the interest of 3,000 plus RNs across the state of Nevada. We are in support of this bill. Thank you. Hello, Chair Brown May and Assembly Committee on Health and Human Services. My name is Elizabeth Flores, ELIZABETHFLOREZ, and I'm the Director of the Washoe County Department of Juvenile Services, which also includes a local facility for the detention of children. For the same reasons that were stated related to child shelters, detention centers are also an inappropriate venue for youth to be held for extraordinary lengths of time, pending much required treatment for significant mental health treatment needs. I stand in support of SB 306. Thank you.
Chair, there are no other callers choosing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you would like to offer testimony in opposition of Senate Bill 306, please come forward here in Carson City or in Las Vegas. No movement. AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Senate Bill 306?
If you would like to testify in opposition to Senate Bill 306, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 306, please press star 9 now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral, thank you. Welcome. You may begin whenever you're ready.
Good afternoon, Madam Chair and members of the committee. For the record, Marla McDade Williams, MARLAMC, capital DADEWILLIAMS. I serve as the administrator of the Division of Child and Family Services in Nevada's Department of Health and Human Services. As you know, DCFS operates a state children's psychiatric hospital that provides both acute and residential treatment for children with emotional disturbances, which is Desert Willow Treatment Center. This is about kids. They do have behavioral issues, and we can't lose sight of the fact that most of them have already been through treatment. Sending them back to treatment isn't going to yield any different result. DCFS has community-level supports, including wraparound services through a contractor, and participation levels and program completion are very low because of the intense commitment required for participation. While the intent of this legislation is commendable, the proposed statutory changes will have serious and potentially unintended consequences for the State General Fund, Desert Willow Treatment Center, and the children we serve. There are currently about 70 youth placed out of state. Courts don't order placements to private facilities, they order to DCFS, and we have a 44-bed facility right now. Requiring court approval for any discharge plan not agreed upon by both parents or legal guardians significantly complicates and delays the discharge process. In cases of parental conflict or absent guardianship, a clinically ready child may remain hospitalized unnecessarily, leading to prolonged inpatient stays, increased legal and administrative burden, and delays in care for other children awaiting admission. The prohibition on discharging children to temporary facilities, such as emergency shelters or short-term group homes, removes critical transitional options from the continuum of care. There is no system in Nevada to address a situation when a family will not take their children back after a mental health inpatient stay or after release from the juvenile justice system. Right now, the only option is the child welfare system, and as you've heard, that isn't the answer either. The inability of DCFS to comply with the requirements of this bill may also result in contempt of court charges and expensive fines that will be paid for with state general fund dollars. Our priority is to provide timely therapeutic care and help children return safely to their communities. We fully support the goal of ensuring safe and appropriate discharges for vulnerable youth. However, there are serious potential unintended consequences with this bill. Thank you.
Good afternoon. For the record, Teresa Benitez Thompson with the Office of Attorney General, here today with comments from our office and neutral just for awareness purposes, consideration as you guys all make the big important decisions for the state of Nevada. So in December 2022, the Department of Justice initiated an investigation against the state of Nevada for unnecessarily institutionalizing children. At the conclusion of the investigation, the Department of Justice found Nevada in violation of the Americans with Disability Act and the U.S. Supreme Court case of Olmstead for failing to provide services in the most integrated community setting and instead relying heavily on residential treatment of children. On January 2nd, 2025, Nevada and the Department of Justice signed a settlement agreement. This agreement provides for screenings and assessments to identify needs, service planning and coordination, building the capacity for home and community-based services, mobile crisis services, and intensive in-home services, along with a limit on residential treatment of children. Nevada has worked diligently to implement this agreement, including hiring the University of Connecticut as an expert. The concern that we just want to make sure is at the forefront of minds is that SB 306 could potentially continue Nevada's heavily reliance on residential treatment for children. Section 3 explicitly keeps children in an institution until a court approves a discharge plan if a parent does not approve, along with Washoe or Clark County Child Services. This will cause delays in discharge while we wait for a court hearing. It will cause more court hearings for a child. And this goes directly against the Department of Justice agreement, where Nevada agreed that children should be released from an institutional setting as soon as possible when a clinical assessment indicates that the child can be supported in a more integrated setting. Children, unfortunately, will remain in an institutional setting for significantly longer than they should. In addition to the Department of Justice, there's a concern that if the Department of Child and Family Services does not have a bed available for a child within the 30 days, DCFS will face sanctions on a daily basis from the courts when the child is not offered a bed or when a bed is not available. The Nevada Supreme Court has allowed courts to sanction state agencies when agencies do not have capacity. Currently, Nevada is paying significant monetary sanctions to courts for not having capacity to treat on the adult level. Nevada's sanctions have totaled hundreds of thousands of dollars, and actually in state fiscal year alone will be over $1 million. So for those of you who sit on the IFC committee, when you leave the building for a couple of weeks after sine die, right, and then you come back for that first IFC hearing in June, you'll be seeing this item before you to pay for some of those sanctions. Our chief, Sharon Benson, is actually not here today because she's in court regarding a set of sanctions in Washoe County. It will take time for DCFS to build capacity to meet the needs of our children. That capacity has to be built out. We're not at all negating anything that you're hearing in testimony in the need for treatment, in the need for services, the need for more beds. But during that time, DCFS and the Attorney General will spend hours in court and an unknown amount of time of state general funds facing sanctions in the courts. Thank you so much for your consideration.
Thank you. But before you leave, former Majority Leader, Assembly Member, distinguished member, would you be so kind as to entertain a question from Assembly Member Haven?
Thank you, Chair, for the indulgence. I really appreciate it. And
former Majority Leader. I appreciate you bringing up these concerns. And I think we all have the same issue where we want to help the children, but we also don't want to be put in a situation where the Attorney General's office is tied up litigating this. And so, and if I hear you correctly, if we pass this as written, we will end up in litigation with the federal government. And then my follow-up question would be is there a way to maybe work with the bill sponsor to work on the timing of this to help prevent litigation so the full build-out could take place to help offset and hopefully prevent some of that litigation that you are referring to?
Thank you so much, Assemblymember Hafen. To you, through Chair Brown May, Teresa Benitez Thompson with the Office of Attorney General, for the record. So to be clear on a couple of things. So one, we had it, such as is the algorithm of the legislative process right now, quick conversations with both bill sponsors after the first reprint came out to send, but those were only very recent, and we are happy to engage with the bill sponsors. We know them to be wonderful, problem-solving, proactive legislators, so I don't have a big concern at all that we're not going to continue conversations. I think we all have the same goal. It's just a matter of making sure that we don't end up with children in residential treatment for too long. And I don't think anyone wants to see, a child, maybe like a child welfare child who comes in at, 5 or 6 into the system, inadvertently end up in residential treatment till they're 18, or on the juvenile justice side till they're 21. No one wants that, right? So I think we have shared goals. I believe that's possible. On the litigation side, just to be clear, so we were already sued by the Department of Justice, and having the agreement in place makes that lawsuit stayed. And so as long as we are complying with the agreement, then we avoid further sanctions by the Department of Justice. I didn't upload the agreement for the committee, but I could always share it with you. I know if you were on the interim health committee, you had a presentation about the agreement. There's been talk about the agreement, but I don't want to make the assumption that anyone sat down and read the agreement. But there's very good things in there. It's absolutely the direction that the state of Nevada has to move in. It absolutely is about more services for kids and some really, I would say, if I could speak more generally, it ought to really be lighting a fire under the state and DCFS to get these services in place and to really focus real money and resources to make these happen. Per the Department of Justice agreement, there's going to be an independent reviewer. There's going to be baseline data. There's going to be quarterly reports on the data, including the number of kids in residential treatment and the number of kids getting home and community-based services. The state's feet is going to be held to the fire on the services to keep kids out of residential treatment and be successful in their home environment, even if that's foster home or such, but outside of the residential treatment. And all of this has to be accomplished within 5 years. If I didn't say it, we have an independent reviewer, the quarterly reports. It's a pretty meaty agreement. And our hope, I think everyone's hope, is that we're going to be in a better place year after year after year than we are right now.
Thank you. You're welcome. Thank you so much. We appreciate you being here. Is there anyone else who would like to offer testimony in neutral here in Carson City? Seeing none and no one in Las Vegas offering testimony in neutral. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on this measure?
If you would like to testify neutral for Senate Bill 306, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral for Senate Bill 306, please press star 9 now. Chair, there are no callers wishing to testify neutral at this time.
Thank you. At this time, we'll call our bill sponsors back up if you would like to make closing comments.
Erica Masio for the record. Thank you, Chair. Thank you, Committee. I know this is a longer one for this side of the House, but I would say this is a policy decision. This is what do we want for our kids in Nevada. This is a hard thing, but I know that our state can do hard things. This is about appropriate placements, plans, and collaboration. And two things I just wanted to say as well is that the DOJ agreement doesn't prohibit residential treatments if it is the appropriate designation. And the bill is really just trying to highlight community services, wraparound services, and our students, our kids, our families that are suffering. And so I hope you'll consider that when we're thinking about this bill. And she was able to leave her committee, so now the senator will also add. Thank you, Chair.
Hello, thank you, Chair and committee member Shelley Cruz Crawford. For the record, Senator for Senate District 1 in North Las Vegas. I just wanted to briefly go over again in closing what this bill does. I decided to carry this bill because I was a child in foster care in Child Haven, and I've come full circle to be a principal that oversees a school that has a unit of students that have schizophrenia and bipolar. Sometimes they do go into these treatment facilities. Going full circle, I now have a doctorate in organizational leadership and ed policy and focused on policy for big issues like this. And what I'd like to tell you is that I think that this policy is directly in line with the decision that was shared earlier today. We are keeping our kids in their area, in the least restrictive environment, and providing support. And the way that we are able to fix big issues like this is that we put pressure across the board to simultaneously give our children the support they need while also providing care to our staff. So I want to thank everyone that shared. And in closing, I'd like to say right now, according to the Gwynn Institute, we also have a shortage in the state of Nevada with school counselors, school social workers, and school psychologists. But as a school principal, I am not allowed to turn away any of my students that need social work, school counseling, and school psychology. And what we do is we share the workload, we put pressure across the system, and then we're able to create policy to change that. And this policy does just that. Thank you so much for hearing this bill today.
Thank you. We will now close the bill hearing on Senate Bill 306. Next on our agenda, we will move into Senate Bill 295, revising provisions related to food establishments. And we will welcome the distinguished Senator Dagnate to the table. Please take your time. You may begin whenever you're ready. Senator, just to remind you where we were in the beginning, we've asked each of our presenters to try to stay at 15 minutes for their presentation, and then we're doing 10 minutes in support, 10 minutes in opposition, 10 minutes in neutral. I think I said 20 earlier, but I really meant 30 total public comment. Go ahead, whenever you're ready.
Thank you so much, Chair Fabian Dognate, for the record. I'll try to make my presentation as fast as I can. Good afternoon to the members of the Assembly Committee on Health and Human Services. For the record, Fabian Dognate, representing Senate District 10 in Las Vegas. Today I come before you to speak on Senate Bill 295, a bill that revises provisions relating to food establishments. Jennifer McDonald, who is from the Institute for Justice, is attending online. She has helped me with this bill in terms of the drafting stages, and so she's also available for any questions that you may have for us as we're going through this. Today, I'm going to talk to you about the world of sidewalk vending, provide a refresher on Senate Bill 92 from the last legislative session, and then cover the provisions of the bill. So, while many of you know already a sense of who a sidewalk vendor is, I wanted to offer a fuller picture of their background and work ethic. Their diversity in age and their ethnicity often exceeds that of the cities that they serve. On average, our street food vendors work 8 hours plus per day, and they earn about $24,000 to $36,000 annually. So it's not a high wage profession. Many of them work outside in the long summer hours. During the previous legislative session, a bipartisan group of policymakers, including many of you who sit in this committee, voted and recognized the unwavering commitment of these Nevadans and worked to decriminalize their livelihoods. For the first time in state history, street food vendors had the opportunity to legitimize their business by applying for a license. However, we faced certain challenges across the several months thereafter, and community leaders noticed that the lack of education on business protocols, zoning requirements, and of course, health district related licensure requirements limited how often vendors could take advantage of the legalization. To further illustrate this point, I want to walk through you the process of obtaining or becoming a licensed food vendor. You'll find that it's quite of a daunting process to legally operate as a vendor in this business. One of the first results you'll see, depending on where you live, is we're going to use the Southern Nevada Health District as an example today, is at the Southern Nevada Health District's mobile food vendor application page. From the moment you open the page, you will notice that there isn't a clear workflow or a listed required items. The page will mention to you certain documents and packets, but it doesn't provide you pictures or links as to how you can reach them. I distilled the process into 6 steps. First, you must call to request an application packet, which will either be delivered or made available for pickup at a later date. And after filling out that packet, you will need to scan and submit it electronically. Then you'll wait for them to review it and schedule a plan review appointment. And after the plan review, you'll set up with an inspection appointment, and additional fees apply if you miss, cancel, or arrive late to the inspection. To some of you, that might seem like a reasonable process. Perhaps it could be improved by adding more direct links to the packets or including a checklist on the page. However, that's just one of 11 steps and the accompanying fees that you need to navigate in order to sell something as simple as corn on the cob or a piece of cucumber. This is Clark County's regulated business checklist, which is fairly well referenced and has a good number of tutorials online for comparison. First, you'll need to register with your business through the Nevada Secretary of State's website, then with the Department of Taxation, and finally through the Clark County Clerk's office. After that, you'll apply for a health permit and a food handler's card, and proof of general liability insurance will follow, along with a commissary lease agreement if applicable, and I'll come back to that in a second. Once that's settled, you must provide conveyance specifications, a major point of contention for vendors since information about cart policy is inconsistent. And afterward, depending on your county, you must also submit a final application, and fees, of course, apply in most of these steps. These regulations, of course, have merit, and standardization is essential to ensuring that Nevadans consume safe food and that vendors are properly accounted for. However, the financial and bureaucratic burdens only discourage well-meaning vendors from participating in the process altogether. That's why SB 295 seeks to remove the requirements pertaining to commissary kitchens and streamline food cart acquisition. So I want to show you what the costs are, the burdens that many of these vendors have to go through. So these are the associated fees with becoming a sidewalk vendor in terms of getting licensed. So I'm going to cover just quickly. As you'll see on the slide, right, to get a business name certificate, to go through the Department of Taxation and then get a Nevada business license. In Clark County, there's a requirement that you have to also get general liability insurance. It's around $620, as you may see, just from the state side. Now, for the health district, the SNHD plan review, as you'll notice that amount, along with the annual health permit fee. So it's around $800, plus or minus so, just to go through the health district. You would also have to get your food handler safety card, which is $25, and then the cart is variable. The cheapest cart that we saw that is not really movable but can be fixed is around $4,000 to $5,000. The cart that would be movable, right, if you wanted to see the ones that would be in compliance with the health district requirements, the cheapest one that we found was around $8,000. But the first real vendor that we were able to license in Clark County, he spent around $14,000 for his cart. He wanted to have more offerings and be fully mobile, and so that was the amount that we paid for his cart. So the lowest we've seen is $4,000 to $5,000, but it can range up to $15 as we have with this vendor. And then the commissary fee is $250 per month. Annually, it's around $3,000. And then depending on where you operate, right, you might operate in multiple cities. You may not operate in multiple cities. Most of the county and city business license amounts are probably around the same, both for the application and for the renewal. So you're looking around, I would say, $180, $200 just for, depending on one city that you apply for. Obviously, if you want to work all throughout the city, you have to pay more for it. So in total, for the street food vendor that we were able to help license first, we spent around $19,000 just to start them up. This does not include any marketing items or anything to purchase the food that actually needed to be vended. This is just to start up. And then obviously the continuing costs are outlined for you. Through SB 295, what we would do is for certain food items, the food items that we have deemed to be non-potentially hazardous, these vendors will no longer have to go through a commissary. They have mentioned that this is the biggest burden for them because they have to travel to go prepare the food and then go out into the community. This would at least allow them to still be in compliance with the regulations and the laws as we have designated through SB 92, but they can prepare them at home based on the items that the bill specifies. And so now we're looking at essentially reducing it by $3,000 to $4,000, which is pretty significant, down to $16,000. They still would be required to go through, get the health inspection permits and everything the same way that we've done before. Now they wouldn't be required to do it at a commissary. So that's pretty much, they don't have to go through another third party to prepare the food and so forth. The bill defines key terms relating to sidewalk vending. It requires local health boards to create multilingual, accessible online information. It also exempts vendors, as I mentioned, selling whole produce and prepackaged foods and other food establishment requirements. Madam Chair, for the sake of time, I would go ahead and answer any questions. I just want to make one more quick comment. You may have seen a conceptual amendment to the bill. The conceptual amendment is really simple. Number one, it pretty much one of the food items that would not be required for a commissary. I received a constituent request to add tea. We added coffee as part of the reprint, and so we are adding tea as well. The rest of the provisions in the conceptual amendment were what was proposed in the Senate reprint, but it did not carry over in the version that we received. And so we are conforming with what was approved in the work session. So that's pretty much the conceptual amendment. And I'm happy to answer, myself and Jennifer are happy to answer any questions that the committee may have.
Thank you, Senator. That was really well done. Very quick. We do have a number of questions. First, we'll start with Assemblymember Goulding.
Thank you, Chair. Thank you for the presentation. I am wondering if you could talk a little bit about when foods are prepared at home, how do you know that they're safe? So in the commissary, there's some requirements, right? There's a bunch of safety and food safety stuff. So when they're being prepared at home, how do we know that they're still safe for public consumption?
Thank you so much for that question, Fabian Doñate, for the record. So this is, I'm going to use my public health background now to explain where the contention is because I want to be transparent to everyone. What I have argued from the very beginning of this process, from SB 92 to what you have in front of you today, is that in order for the system to work, you have to have folks comply with the law. And what we saw in Las Vegas was that for years, and also this is happening here in Carson City and also in Washoe County, what we saw for a long time was that many of these street food vendors were not in compliance with the law. And the rationality for that was because we had made our laws so complex, we had criminalized their actions, and we did not provide them a pathway to obtain proper licensure, right? It was kind of a finger-pointing game where the county was not doing something, so the health district would point towards the county, and the county would point towards the health district because it was onerous for many of these vendors to be able to apply for a license. My argument with Senate Bill 92 was that we need to stratify the public health risk, which means that everything that we consume, everything we touch from this paper to what I consume has some level of risk. Me walking up the stairs has a level of risk. But as public health folks, we should focus our attention to the items that have the greatest risk, right? We should stratify the public health risk levels. So for example, cutting an orange, in my opinion, has a less risk than preparing and eating uncooked meat. That is a level of stratification of risk. And so what we have proposed in this bill is that for certain food items that many of these vendors have, that we will stratify the public health risk. In Section 10 of the bill, they still have to be required to essentially be subject to health inspections, right? They still have to buy the carts that are in compliance so that they're cooking efficiently, right? They have to have hand washing stations and so forth. That was an amendment that I proposed from the Senate reprint to what you have before you here in the Assembly. But for certain food items, it just doesn't make sense to require them to go through a commissary. And that's what we have put forth in these provisions. What I also want to remind committee members is that many of these street food vendors, they purchase their items from the grocery store. They're not making many of the items themselves, right? Like they have Dorito chips and other types of food items that they purchase directly from the grocery store. They're just repurposing it on the cart themselves, right? They might open a bag of chips and add hot sauce to it, which, by the way, that hot sauce was also commercially produced. And so for those types of instances, right, for the items that have the lowest public health risk, that's what we're defining in this bill. So it's not really about how do we ensure that their kitchens are in compliance. It's we have to realize at some point that we have to stratify the public health risks so that more folks can be in compliance with activity that's already happening locally. And I hope that answers your question.
Thank you. I appreciate that information.
Thank you. Next question from Assemblymember Nadeem.
Thank you, Madam Chair. My question is almost very much similar to what the Assembly member asked earlier. So that is my question, that how we will feel that, and it will come up to be that the food that they are serving is safe for the fellow Nevadans. And any suggestion that they are saving the fees, but are you adding anything, Senator, that is gonna be helpful for and more safe, that will make the food more safe for the Nevadans?
Thank you so much, Fabian Oñate, for the record. So I would argue that requiring vendors to go through this process, right, when you have more of them come into compliance, when you have more of them apply for the license, go through the food handler safeties card, that does make the foods that we're consuming more safer, because now folks are able to understand that they have gone through some level of regulatory changes, right? The question becomes, at what point does the system become too complicated for people to navigate, right? And from many of the vendors that we've spoken to, right, the commissary requirement is the one that consistently comes up. And so this is essentially still the middle ground, right, where we're not completely putting everything to be made at home, which, by the way, we already do for cottage foods. We still are going to require them to go through the process, but for some of these items that we have deemed to be non-potentially hazardous, that they don't have to go to a commissary to prepare it. So they still have to meet their other obligations in terms of zoning requirements and sort of liability requirements and so forth. It's just for these specific food items that are in that section of the bill, they would no longer have to go through a commissary.
Can I have a pen? Thank you, Chair. So, and I am interested in knowing regarding the other states. Is there something like this happening in the other states too, giving the leverage to the vendors?
Thank you so much, Fabian Oñate, for the record. Yes, so multiple states have grappled with this, and I'll defer to Jennifer to help me answer this question as well, because she's more on the national scope. So the provisions of this bill was taken from California, right? California has done some level of this as well. They have struggled because they have more health districts, so it's more complicated than it is here in our state. We're a smaller state. We're more flexible in terms of our changes. Arizona just passed what's known as the tamale bill. That one goes more extreme because not extreme, but it goes more further, where people can prepare, for instance, a tamale at their home through home kitchens. This bill does not do that. This bill, if you as soon as you deal with meat, you are not in compliance with the provisions of SB 295. And then there's other states that have done so, for example, Florida and so forth, where it's more of a fruit freedom, right? So they treat it more as cottage foods. But perhaps Jennifer can add to that if there's anything else that I'm missing.
Absolutely. So Jennifer McDonald, for the record, with the Institute for Justice. We're a national nonprofit that has been working on these types of laws for decades now. And what we see at the national level is that states are increasingly recognizing that these foods are safe. So there are currently 8 states in the country that allow homemade food producers to sell pretty much any food, including California, including Arizona with the tamale bill that the senator mentioned, as well as a handful of others. And I have a background in quantitative research, and so I did a study a couple of years ago where we looked at every single state and every single health district that has these laws, and we found absolutely no confirmed cases of foodborne illnesses as a result of the consumption of these homemade foods that were sold in communities. So what we're really seeing is that states are understanding that homemade food producers make their foods on such a small scale with such personal attention to detail that they are oftentimes much more sanitary, much more cognizant of safety than larger commercial establishments, simply because their reputation is really the foundation of their business. And so we don't see increased rates of foodborne illnesses when these types of foods are being allowed to be sold. The foods that we're considering under SB 295 are not those that are deemed potentially hazardous, that do not require extensive time and temperature control to keep them safe. And so we expect those results to hold true in Nevada, if not even more so.
Thank you. Next question from Vice Chair Nguyen.
Thank you, Chair. And Senator, I have just a really easy question for you. I can't find the effective date on this. Are we... kind of cut off, kind of strange at the end.
Fabian Oñate, for the record, that's a point that I actually did not catch until right now. So perhaps I don't know if legal wants to chime in or we can fix that in the amendment. Thank you.
Thank you. We'll defer to legal. Mr. Noss.
Thank you, Chair. David Noss, LCB Legal, for the record. When there is no effective date in the bill, the effective date is the default date, which is October 1st of the year of the session. So it'd be October 1st, 2025 for this bill. Thank you, Chair.
Just a quick follow-up. Is that your intention, Senator?
Thank you so much, Fabian Oñate, for the record. I think that's plenty of time for the health districts to adjust, and so I would be fine with that.
Great. Thank you. Thank you, Chair.
Thank you. Next question, Assemblymember Hibbets.
Thank you, Chair. Senator, I am looking at Section 13, subsection 1, and you have struck out the portion in here where it says a county population. You struck out the pop cap. So, and this may be a better question for legal, but I'd also like the intent. So would this then open up to every county in the state, except for sections 7 and 9, which do have a pop cap under section 6? Everything else appears to no longer have the population cap of 100,000 or more. So if possible, I'd like to know your intent of that, and then also legal's opinion on whether that would work the way I'm looking at it.
Thank you so much, Fabian Oñate, for the record. I believe that was a provision made from legal in terms of the drafting of the bill. It was a conforming change because we were looking at the local health districts. But if there's any other comments, I believe.
Thank you. Mr. Nouse.
Thank you, Chair. David Noss, LCB Legal, for the record. So yes, it's a conforming change because in section 6, we are stating that the relevant sections about the regulation of the food carts apply to a local board of health in a county whose population is 100,000 or more, or a city in a county whose population is 100,000 or more. So because that is in section 6 now, it no longer needs to be in section 13. Not only because it doesn't, for it not to be duplicative, but to ensure that section 7 and 9 also are included within the population cap.
Just to clarify, so it still only applies to Clark and Washoe?
Fabian Oñate, for the record, that's correct from my interpretation of what was the intention. But
currently, yes, as I believe those would be the only health districts that meet that population cap. But obviously, we cannot adopt local ordinance, a local act. So any future health district that falls into that population would also be included.
Thank you very much, and Chair, thank you for the question.
Thank you. Members, any other questions? Assemblymember Hafen.
Okay, thank you, Chair. And thank you, Senator, for bringing this forward. One of the, and I know there's PopCap, I'm going to use Nye County as just a reference point for some of the questions that have come up previously from my constituents. And we had adopted an ordinance to allow street vendors and some of the local businesses were concerned that the street vendors and the food trucks, they were both in the same ordinance, were being given an unfair advantage because, like in your bill, you're reducing some of the fees and doing some other things to reduce the burden, which I think is good. But how do you address the potential for, let's say, a coffee street vendor setting up in front of a coffee shop, and the coffee shop now still has to go through all of these things and spend all the money, and the street vendor could then basically undercut the prices, theoretically produce the exact same product because, like you said, they could just buy it at the grocery store. So how do you address that concern that has been brought up? And again, I understand it doesn't apply to Nye County, but those are the concerns that did come up to my constituents, and I do believe it applies to everyone throughout the state.
Thank you so much, Fabian Donate, for the record. That's an excellent suggestion. And I actually, when the ordinance was passed by Clark County, I was in agreement that there should be limitations as to how far they are from a business, a brick and mortar business. I still remain supportive of that. I believe that that's something that the local counties and the city jurisdictions should 100% be responsive of, because I do think it could be unfair as to the scenario that you mentioned. This one, of course, only looks at specifically the process of going through the the public health regulations. But I did, to help you answer that question as well, there was, as part of the reprint, we wanted to make sure that we weren't changing any ordinances or further restricting them. And so that was reflected in there. And then another thing is, there's been a debate as to whether or not the health districts or the local counties have the ability to impound equipment, and we have put that in the bill as well. And so now there is no gray area, so that if there is someone in violation of so forth, whether they're not compliance of the law or they're refusing to do so, now the county or the local health authority can actually impound the equipment. And so hopefully that addresses some of the issues that have been pervasive through the implementation of SB 92, and I thought it was a pretty substantial but a good compromise.
Thank you. Next question from Assemblymember Gonzalez.
Thank you so much, Chair, and thank you so much, Senator, for this presentation. I just wanted to go back to the slide when you had all of the prices and just getting clarification about how much this would save them. So if they... No, I think it was the one you were just on, right? The commissary monthly fee would save a street vendor about $300 annually.
Fabian Donate, for the record, that's incorrect. $300 per month. Sorry, $260 per month, $3,120 annually.
See, this is why I have
on
classes.
On top of right the that's just the money part. There's also a difficulty of having to wake up early, go to the commissary, prepare the food, and then go out before you can even sell to the community and so forth, and then having to return back to the commissary for the storage and so forth. So it's not just the money aspect; it's also the physical aspect of how you operate the business day to day. Yeah.
Thank you. I appreciate that. And I was curious in what other obstacles or barriers that street vendors have in doing and working on this bill, and why, out of the many things that they go through, did you focus on this to help alleviate some of that?
Thank you so much, Fabian Donate, for the record. That's an interesting question. I think the bill does not fix this issue, but I want to make sure it's stated on the record. One of the most difficult parts of implementing this bill is that we've organized many street food vendors over the last 2 years. We've had as many town halls as you can imagine for any bill implementation. I think all the cities and counties would attest that this was probably one of the most difficult bills just because of the complexity of it. And it's hard because the legislature was catching up to an issue that has been accepted by the community, right? And so you have to re-educate folks as to what's new, how they can come in compliance, right, as part of the new system that would help them out in the long term. But one of the frustrations that I faced was that, many of these vendors would go to the health districts and they would ask them, how much is a cart, where can I get it, and so forth. And they say, well, these are the places you can go to. Contact them yourself, and then when you're ready, come back, right? There was no menu that they could go off of to at least understand what are the different cart requirements that I need and so forth. They would give examples, right? But they wouldn't tell you up front as to how much it would cost or if I purchased that cart, that it would guarantee the certification of it. And I'll give you an example with Bertin, the street food vendor that is listed, that was this one that went through it. The challenge with him was the health district gave him the consideration of saying, yes, your cart's good to go. But then when he went to Clark County, that was not the case, right? The Clark County told him separately as to what was required or permissible. And so I think that's also been a frustrating factor, on top of having to go through a commissary, having to be in compliance with the law, having to purchase a cart that you don't have money for, right? And to some point, we have to meet the community of where they're at, especially if we want them to be compliant, right? This is a new process for all of us. This is a new business, and we should be supporting entrepreneurs the best that we can.
Thank you so much, Chair. I have one more question, if that is okay. Can you go back to the first slide that you had as well about the The one where it was like it had the different box, that one. So this looks very confusing. And if I wanted to be a street food vendor, I would probably get frustrated. And so I'm wondering, does this bill touch about any of those things? Are there organizations that are helping people simplify this process and get this information out in a more simpler way? I know in your opening remarks you mentioned maybe like a checklist. Does this bill help alleviate that issue of this on the screen?
Thank you so much for that question, Fabian Oñate. For the record, it does not fix all the issues, but it fixes the most prevalent one, and that's dealing with the health district regulations. I hope that through the passage of this bill, we would alleviate most of the concerns. Obviously, it's still going to be a financial burden for many of these vendors to start, but at least we can alleviate the operational challenges so that they can be in compliance. And I want to reemphasize that they're only making $24,000 to $36,000 a year, right? Like, these are not the traditional entrepreneurs that you're seeing that are racking up thousands and thousands of dollars. And so at some point we have to ask ourselves, is this really necessary for the food items that they're purchasing from the grocery store?
Thank you so much, Senator. Thank you, Chair. And I would definitely agree with that. Thank you.
Okay, last call for questions. Thank you. Seeing no questions, thank you so much for your presentation. We'll ask you to go ahead and step back. At this time, we will open up testimony in support. If you would like to offer testimony in support of Senate Bill 295, please come forward here in Carson City, as well as in Las Vegas. Go ahead and fill those chairs if you're here to testify in support. We'll ask each of our testifiers to keep your comments to 2 minutes. We're going to spend 10 minutes up here in support in Carson City. We'll do 10 minutes in support in Las Vegas, and then we'll do 10 minutes in support on the telephone lines. If we have extra time, then we will come back around. So we're going to be watching the clock. By all means, we'll start here in Carson City. Go right ahead.
Thank you and good afternoon, Madam Chair and committee members. For the record, my name is Laura Nowlin, Nowlan, and I'm a small business owner. I believe that this bill gives the opportunity for that entrepreneur to just get started, right? Selling paletas. Then after that, they can grow into a bigger, maybe a bigger cart or a truck. And then after that, hopefully a restaurant. So you're really making a big impact on the small business community by voting for this. It really does help the minority community especially. Thank you.
Good afternoon, Assembly members. Linda Fornos for the records, LANDAFORNOS. I'm a grassroots engagement director for Libre Initiative. I had the opportunity to interview a guy who was passing by my house with the cart selling ice cream and all this kind of food. And I had the curious about asking him how much you pay for this cart, because it was kind of fancy, clean, very nice. And he told me, well, actually I'm paying $15,000. And the thing is, I'm afraid of doing this because all the requirements that they are asking for is like a lot of money and also a lot of things that I have to do through the process. The really thing that I really care about that is that they really want to be entrepreneurs. They really want to be successful and start a small business. So why we don't give them the opportunity to be successful? So that's why I really support this bill. Thank you.
Chairperson, esteemed members of the committee, Cesar Minera, Minera. Thank you for the opportunity to testify today on behalf of Libre North, a local and national organization dedicated to empowering the Latino community through policies that promote economic opportunity and personal freedom. We are here in strong support of SB 295, which provides much-needed clarity and fairness for Nevada's street food vendors. Across our state, street food vendors contribute to our economy, culture, and local communities, yet many face unnecessary barriers that prevent them from operating legally. By streamlining the permitting process and ensuring reasonable regulations, this bill will empower hardworking entrepreneurs, support local economies, and help street food vendors provide for their families without the fear of excessive fines or restrictions. The Latino community represents a substantial portion of Nevada's population and contributes significantly to the state's economy. Many Latino entrepreneurs rely on street food vending as a means of livelihood, offering culturally significant and diverse food options that enrich our communities. However, existing regulations often pose challenges that hinder their ability to operate legally and successfully. SB 295 proposes to require local boards of health to provide information and outreach to sidewalk vendors, establish task forces related to sidewalk vending, and revise provisions concerning cottage food operations to exempt certain sidewalk vendors. These measures will facilitate a more inclusive and supportive environment for small-scale vendors, many of whom are from the Latino community. By passing SB 295, we can empower Latino entrepreneurs, promote economic development, and celebrate the rich cultural diversity that street food vendors bring to Nevada. I urge the committee to pass SB 295 to support the hardworking individuals who contribute significantly to Nevada's economic and cultural landscape. Thank you for your time and consideration.
Thank you. Is there any additional support here in Carson City? Please come forward. Go ahead and fill in that chair. Thanks. You'll have 2 minutes. Go ahead and begin when you're ready.
Good afternoon, Madam Chair, and to the members of the committee. My name is Maurice Washington. If you want me to spell it, I will. If not, I hope you. Thank you. I'm here on behalf of Americans for Prosperity. I'm the legislative liaison. We've had the opportunity to work with the good senator on this bill to remove some of the barriers that some of the entrepreneurs find themselves faced with. And so we're here just to say that this is a good opportunity for them to continue to flourish and to continue to grow. For those of you that have not been part of Northern Nevada, let me just say this. We get the opportunity to have what we call Food Truck Fest on Fridays. It's magnificent. The food trucks that come out, the people that participate, it's a great gathering, it's fun, and I tell you what, the food experience is just something to cherish. And these people are hard workers. They put their heart and soul into their work and their craft, and some of the stuff that comes out is just to die for. So I hope you will support this bill. It's a good start. It's meaningful, and I guarantee that the food truck vendors and the vendors will appreciate your efforts. So thank you for your time, Madam Chair.
Hello, Chair, members of the committee. Tony Ramirez, Government Affairs Director with Make the Road Nevada. That's TONYRAMIRZ. In strong support. We've been in this space for a little bit and have seen a lot of the implementation, have tried to assist in those efforts as well. Unfortunately, it's not easy for a lot of vendors. Costs are high. Process is complicated. One of our folks went through the process, spent about $15,000 to purchase their cart. We did identify less expensive carts, but this particular person spent about $15,000 on their cart, approved by the Southern Nevada Health District, and then unfortunately they were denied the permit by Clark County. So we view this as going to clean up and address a lot of those issues. There's a lot of the information isn't entirely streamlined, and we feel that this is going to help folks like that, and appreciate everybody who has put work into this, and everybody's been great to chat to about this. Thank you.
Good afternoon, Chairwoman and Assembly members. My name is Michelle Visconde, MICHELLEVIZCONDE. I am a Grassroots Engagement Director at Americans for Prosperity. And on behalf of Americans for Prosperity in Nevada, I thank you for this opportunity to testify in favor of SB 295, a bill that would make small business entrepreneurship in food services more attainable. AFP Nevada believes government should focus on the most appropriate, least burdensome oversight of businesses to ensure that both entrepreneurs running businesses and workers trying to earn a living for their families are able to chase opportunity instead of permission. SB 295 removes state and local burdens for Nevadans trying to earn income as sidewalk food vendors across the state, which improves both job opportunities and consumer access in our great state. In more onerous licensed states, entrepreneurship rates are lower among low-income residents, recidivism rates are higher for ex-offenders, and other unintended consequences, such as increased crime rates, occur due to decreased deployment opportunities. Removing harmful business and occupational licensing barriers opens the doorway to opportunity that so many are looking for if given the chance. Nevadans deserve the dignity of personal choice as consumers and the ability to support their families with income earning opportunities without undue government burdens as they seek a living. We urge you to please support SB 295 to reduce harmful burdens in our cottage and street food industry, where many of our fellow Nevadans have an opportunity to improve the lives of their families and communities. Thank you for your time.
Thank you. Seeing no other support here in Carson City, we'll go down to Las Vegas. You may begin when you're ready.
Buenas tardes. Buenas tardes, comité. Mi nombre es Olga Romero. Se escribe OLGAROMRO. Soy vendedora ambulante, miembro de la organización Se Hace Camino Nevada y parte del comité de vendedores ambulantes en apoyo a la SB 295. Yo no vendo grandes cantidades de productos ni de productos peligrosos. Vendo gelatinas artísticas, algo simple pero hecho con amor. Aún así me exigen pagar como si fuera un restaurante. Una cocina comercial me costaría más de lo que gano en todo un mes. La SB 295 me daría la oportunidad de seguir con mi negocio sin tener que pagar grandes cantidades y trabajar con reglas justas, sin miedo y sin ser empujada hacia la informalidad. Les pido su apoyo a la SB 295. Somos parte de la economía local y merecemos una oportunidad. Muchas gracias.
My name is Luis Gil, the Spanish interpreter. Name is spelled Luisgil. I will be rendering the interpretation. My name is Olga Romero, spelled Olgaromero. I am a street vendor and a proud member of Make the Road Nevada, as part of the street vendor committee in support of SB 295. I don't sell large quantities or dangerous products. I sell artisanal jello, something simple but made with love. And yet I am required to pay as if I own a full restaurant. A commercial kitchen would cost me more than what I make in an entire month. SB 295 would give me the chance to keep my small business without going into debt. I just want to work under fair rules, without fear and without being pushed into the shadows. I ask you to support SB 295. We are part of the local economy and we deserve a real chance. Thank you very much.
Do we have additional testimony in Las Vegas? If you are ready, go ahead and begin.
Buenas tardes, comité. Mi nombre es Fernando Pérez. Escribe FERNANDOPEREZ. Soy miembro líder de Se Hace el Camino Nevada y parte del comité de vendedores ambulantes en apoyo a SB 295. Llevo más de 20 años como vendedor ambulante. He vendido fruta, raspados, botanas por toda la ciudad de Las Vegas. Este trabajo no solo nos da de comer a mí y a mi esposa, también nos mantiene cerca de la comunidad. Pero en todos estos años nunca ha sido fácil. Obtener una licencia legal es complicado, costoso y muchas veces desmotivante. El SB 295 representa algo que nunca hemos tenido. Una oportunidad justa nos ayudaría a cumplir con la ley y sin tener que pagar por cocinas comerciales que no necesitamos para los productos simples que vendemos. Yo no quiero favores, quiero una oportunidad para crecer, para trabajar en paz, para que el día de mañana mi familia no tenga que empezar desde cero. Por eso les pido que apoyen el SB 295. Los vendedores ambulantes también somos partes de Nevada. Muchas gracias.
This is the interpreter speaking. Good afternoon, committee. My name is Fernando Perez, spelled Fernandopec. I am a member with Make the Road Nevada and part of the Street Vendor Committee in support of SB 295. I've been a street vendor for over 20 years. I've sold fruits, shaved ice, and snacks all over the city of Las Vegas. This work not only feeds me and my family, but it keeps us close to the community. In all of these years, it's never been easy getting a legal permit is complicated, expensive, and often discouraging. SB 295 represents something that we've never had, which is a fair chance. It would help us comply with the law without being forced to pay for commercial kitchens that we don't need for the simple products that we sell. I am not asking for favors. I am asking for the opportunity to grow, to work in peace, and to build something my family won't have, so my family won't have to start from scratch. This is why I ask you to support SB 295. Street vendors are part of Nevada too. Thank you very much.
Buenas tardes, mi nombre es Teodora Tepexi y se deletrea Teodora-Tepetzi. Soy vendedora ambulante y miembro líder orgullosa de Se Hace Camino Nevada. Vender en las calles es como mantengo a mi familia y comparto mi cultura, pero nos exige lo mismo que un restaurante, cocinas comerciales que cuestan hasta $600 al mes, permisos de salud hasta $500, licencias por cada ciudad y carritos que pueden costar $5,000. Este año fui a pedir ayuda y todo está en inglés. Cuando pedí ayuda me mandaron a un lugar más lejano para pedir información. En zonas rurales como Eli ni siquiera hay cocinas disponibles y si acaso permiso en una parte de la ciudad. No me sirve en otra. El SB 295 reconoce estos problemas, nos da opciones reales y nos permite trabajar con dignidad. Les pido que voten a favor. Muchas gracias.
Good afternoon, committee. My name is Teodora Tepetzi, spelled Theodoratepetci. I'm a street vendor and a proud leader of Make the Road Nevada. Selling on the streets is how I support my family and share my culture, but we are held to the same standards as a full restaurant. Commercial kitchens that cost up to $600 a month, health permits up to $500, and business licenses for every city, and cards that cost more than $5,000. This year, I want to ask for help, and everything was in English. When I asked for assistance, they sent me very far away just to get information. In rural areas like Eli, there aren't even kitchens available, and if I get a permit in one part of the city, it doesn't work in another. SB 295 recognizes these problems and gives us real options and allows us to work with dignity, and I ask you to vote in favor. Thank you very much.
Thank you. Just so we're clear, we're now at 16 minutes, so we only are going to have time for maybe two more in Las Vegas, and then we're going to go to the telephone lines. Go ahead.
Ok, buenas tardes. Mi nombre es Heriberto Ramírez y soy un orgulloso vendedor ambulante y miembro de Make the Road Nevada. Estoy aquí porque la venta ambulante me ha permitido mantener a mi familia y construir una vida digna. Apoyo la propuesta de ley SB 295 porque abre la puerta para que personas como yo podamos trabajar con permiso y sin miedo. Actualmente el proceso para obtener una licencia es muy costoso y complicado, especialmente para quienes vendemos alimentos de bajo riesgo como fruta, botanas y productos empacados. El requisito de rentar una cocina comercial representa una barrera económica que muchos de nosotros no podemos pagar. El SB 295 eliminaría esa barrera y permitiría que vendedores como yo podamos trabajar legalmente y con dignidad. Esto no se trata de un negocio, se trata de sobrevivir. de mantener a nuestras familias de manera segura y honesta. Les pido respetuosamente que apoyen el SB 295. Gracias por su tiempo y por escuchar nuestras voces. Muchas gracias.
Hello, my name is Heriberto Ramirez. I am a proud street vendor and a member of Make the Road Nevada. I am here because street vending has allowed me to support my family and build a dignified life. I support SB 295 because it opens the door for people like me to work with permits and without fear. Currently, the process to obtain a license is very costly and complicated, especially for those of us who sell low-risk foods like fruit, snacks, and packaged goods. The requirement to rent a commercial kitchen represents an economic barrier that many of us cannot afford. SB 295 will remove that barrier and allow us vendors like me to work legally and with dignity. This is not just about business, it is about survival, about being able to provide for our families safely and honestly. I respectfully ask you to support SB 295. Thank you for your time and listening to our voices.
Thank you. We're
Good
now at
afternoon,
almost
Chair.
19 minutes, so this will be our last testimony from Las Vegas, and then we'll go to the phone lines. Go ahead.
Thank you. Good afternoon, Chair and members of the committee. My name is Ritu Lali, and I'm a Filipino-American business owner here in Clark County, Nevada. I would like to point out that I graduated from UNLV and have the privilege of speaking English, and yet I have been working on my permit from the health department for the last year at this point. We sell loose leaf tea, like tea leaves that you put into bags, at local events and farmers markets. And since my background is in traditional tea and I've been in this industry for 12 years, we share tea in the traditional way, which is to brew tea in a teapot so that when you're there with me, you can try the teas before you buy them, which makes sense in theory. But based on current local regulations, we cannot brew loose leaf tea at the markets because even if there are separate people handling the tea in cash, even with a hand wash station that would be approved in other states, which we've confirmed, we cannot brew and sell tea. Instead, we are required to have a setup that will cost us $15,000, and I'm shocked that this number comes up again. We did not trade notes, plus a commissary in order to brew tea. This is unnecessary for a product that has zero food safety issues. And for us as a small business, we are a working class household that cannot afford that amount. Again, it's been a year that we've been working thousands of dollars in temporary permits and fees. And to be honest, we've been asked or advised by our colleagues in other states, just as a joke, just move states. But I don't want to do that. I grew up here in Nevada. I started this business in Nevada. And when I see the faces of my customers at those markets, they are shocked to see that they can experience such amazing teas and food culture here in Nevada. So for those reasons, I please urge support of SB 295. Thank you very much.
Thank you. Before you leave, would you please spell your name for the record?
Thank you. Rietulali.
Thank you. Okay, thank you. For anyone who is still in Las Vegas, you are welcome to stay. If we have time, we'll come back to you. We are going to move to testimony on the telephone lines. AVH, is there anyone who would like to offer support testimony on this measure at this time?
I'll go. All right. Cyrus Hojati,
No,
H-O-J-J-A-T-Y.
Mr. Holjati, if you would please hold. We're going to go to the telephone lines, and if we have time left, then I will come back down to Las Vegas. AVH,
Sorry.
Thank you. AVH, is there anyone on the telephone line?
If you would like to testify in support of Senate Bill 295, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 295, please press star 9 now.
Hello, Chair and members of the committee. My name is Vanessa Ramirez. I am a senior in high school and a student and volunteer for the Libre Initiative here in Nevada. I'm calling to support SB 295 because street vendors are a big part of our communities and honestly a big part of a daily life. As a student, I don't always have a lot of money or time. But street vendors offer affordable and delicious foods that I can grab quickly on the way home or after practice. It's not just the prices, it's the variety from tacos to tamales and fresh fruit. Street vendors bring culture and flavors to our neighborhoods. They also create a sense of community and gathering people together around food. SB 295 gives these vendors a fair chance to operate legally and safely. They deserve respect and support, not fines or punishment. I hope you'll stand with them and with students like me by passing this bill. Thank you for your time.
Chair, there are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll go back down to Las Vegas. Mr. Hojati, you are welcome to take your 2 minutes. You may begin whenever you're ready.
Thank you. I appreciate it. Good afternoon. Cyrus Ojati, Hojjaty. I support this bill, provides opportunities. I will ditto the previous commentators. And yeah, I'm a big fan of tacos. Hopefully they're as delicious as they are in Tijuana when they operate. Thank you.
Thank you. Is there anyone else in Las Vegas who would like to offer testimony at this time in support of this measure? Okay. Seeing none, thank you all very much. We will move now into opposition testimony. If you would like to offer testimony in opposition of Senate Bill 295, please come forward at this time. We'll do the same thing. 30 minutes total, 10 minutes here in Carson City, 10 minutes in Las Vegas, 10 minutes on the telephone line, and then we'll go around again if necessary. You may begin when you're ready.
Good afternoon, Chair Brown May and members of the committee. My name is Amber English, Environmental Health Specialist Supervisor for the Northern Nevada Public Health. We support small food entrepreneurs, but not at the expense of food safety. We respectfully oppose Section 10, which would allow the preparation and sale of higher-risk foods from a private home kitchen without the food safety controls required for permitted food establishments. While this proposal no longer falls under the cottage food law, it effectively creates a new, unregulated category of food operations without inspections, training, temperature control, and other food safety requirements. The foods listed in Section 10 include cooked vegetables, which are not low risk. These items require time temperature control to prevent the growth of bacteria that can cause serious foodborne illness. Preparing and handling the foods listed in this section in an unregulated home kitchen, especially without the required packaging, health warnings, and labeling, presents a significant public health risk. We are also concerned about where these foods are being sold. Sidewalk vendors often operate near schools, serving children who are a highly susceptible population and in communities that are already burdened by health disparities. Finally, we have to ask, how are these food items determined to be safe? Is there any scientific or regulatory basis for including them? We've seen no evidence that would justify bypassing the safeguards that exist for other food establishment operators. We urge you to oppose this bill to protect the health of Nevadans, especially our most vulnerable. Rather than lowering standards, we support practical, equitable solutions like the unanimously recommended state-funded commissaries in Washoe and Clark counties. These facilities proposed by the Street Food Vendor Task Force, created under SB 92, would help reduce the economic barriers while also still maintaining public health protections. Thank you.
Good afternoon, Chair Brown May, members of the committee. For the record, my name is Nick Schneider, Director of Government Affairs for the Vegas Chamber. The Vegas Chamber is here in continued opposition to SB 295. We would like to thank the bill sponsor for working with us to start addressing those concerns, particularly with revisions to Sections 8, 9, and 11. However, we do need to echo the concerns of our colleague that just testified as in regards to open food handling, with particularly in Southern Nevada, being a world-renowned tourist destination and one of our primary economic engines, we do have concerns that any of these health safety violations that could occur could negatively impact that reputation and therefore traffic. Further, we do still have concerns with the stationary items included in the definition of a conveyance in Section 3, and look forward to continuing to work with the sponsor to find a resolution. Thank you so much.
Thank you, Madam Chair, members of the committee. Bradley Mayer, representing the Southern Nevada Health District today. You're going to hear from some of the, a couple of the Southern Nevada Health District experts down south, so I'll be very brief. I do want to thank Senator Donate. We've had a lot of engagement with him in this process. This bill has come a long way from where it initially, of course, started. However, we do remain opposed based on what you'll hear about some of the open food handling, a few of these items. We did submit a exhibit that shows sort of the food items that we had kind of agreed with being in this bill, and then the ones that are listed not and why. And so, we have licensed 13 vendors already off of original SB 92. It is possible, of course, to come in, and we encourage other vendors to come forward. And we've also worked with some of the proponents on identifying less expensive carts that we will approve. And so a cart for, say, $4,000, we help them with, and it has hand washing on it and the like. So again, it's possible. We encourage people to come in. I thank Senator Donate for his work. We do remain opposed, and you'll hear from a few of our colleagues in the South. Thank you.
Madam Chair, members of the committee, Nick Vasiliadis for the record. On behalf of the Nevada Resort Association, we also thank the sponsor for the hard work this session. Last session, we were able to come to a consensus agreement and get in favor of a bill. Unfortunately, at this point, this session, we just weren't able to get there. So we do stand in opposition, but we do also appreciate the hard work of the sponsor and everybody involved. Thank you, Chair.
Okay, seeing no other opposition up here in Carson City, we'll go down to Las Vegas. You may begin when you're ready.
Good afternoon. My name is Jacob Billings. That's Jacob Billings. I'm the Senior Environmental Health Specialist at the Southern Nevada Health District for the office which handles the permitting of sidewalk vendors as well as the enforcement of unpermitted vendors. SNHD supports the permitting of sidewalk vendors because it ensures food is prepared and served under conditions that meet established health and safety standards. However, we cannot support 295 as it's currently written, as it introduces serious concerns regarding oversight and public health. Since the passage of the original sidewalk vending bill, SB 92 in 2023, we have permitted 13 sidewalk vendors operating from approved commissaries. All of these permitted vendors have received their routine inspection and have earned A grades. Unfortunately, the vast majority of sidewalk vendors do remain unpermitted and operating out of their homes. These vendors are often found selling near schools and community parks where their primary customers are children. Some common violations we see with home-based sidewalk vendors includes food held at unsafe temperatures due to improper equipment, contamination from foreign objects, personal beverages stored in the ice used for consumption, damaged or dirty equipment, pests such as ants, cockroaches, and flies present in the food. Food equipment is routinely observed with heavy buildup of debris due to lack of proper warewashing facilities. Many vendors have no access to hand washing and do not consistently use gloves. In one case, I even observed an operator dousing their entire cart with Raid because of a fly infestation. To support vendors and ensure they can operate safely, SNHD has hosted and attended over a dozen workshops, town halls, council meetings to educate vendors on the permitting process. Our office also offers free consultations to prospective vendors where we can go over cart requirements and help tailor their cart to meet both business and food safety needs. I personally met with all of our local cart builders to discuss these requirements and make myself available by email, phone, and in person to ensure carts meet our standards and helps vendors to succeed. We also have multiple inspectors that speak Spanish to assist with translation if needed. Allowing vendors to operate from home, as proposed in SB 295, removes the necessary oversight and increases the risk of unsafe food being served in our communities. SNHD supports small business and wants sidewalk vendors to succeed and serve safe food, but allowing them to operate as outlined in SB 295 will be a step backwards in food safety. Thank you for your time.
Good afternoon, Chair Brown May and members of the committee. My name is Larry Rogers, Larryrogers. I'm an environmental health manager that oversees the program that regulates sidewalk vendors at the Southern Nevada Health District. The Southern Nevada Health District is in opposition to Section 10's removal of the requirement that open food handling be done in a commercial kitchen. By removing this requirement, items like corn or fresh cut fruit will be prepared in a personal kitchen that lacks the necessary safety controls. Commercial kitchens are specifically designed and regulated to reduce the risk of foodborne illnesses. They are equipped to maintain proper temperature control. Perishable foods are particularly vulnerable to bacterial growth if not held at the correct temperature. Commercial refrigeration can reliably keep food at 41 degrees, even in 100-degree weather, despite frequent opening and closing of doors. Home refrigerators are not built for this kind of load, and when they fail, there is no inspection process to catch or correct the issue. Southern Nevada Health District and Northern Nevada Public Health have submitted a document to the committee that outlines the specific foods in Section 10 that pose safety risks when prepared in home kitchens. Commercial kitchens also limit kitchens to trained food workers. In contrast, home kitchens have no such guardrails. Children, guests, and even pets can enter the space where food is being prepared, increasing the risk of contamination of food surfaces, equipment, and the food itself. These are just some of the things that we're concerned with, but the bottom line is that home kitchens can't reduce the risk of getting people sick from food at the same levels that commercial kitchens can. We also ask you to consider the expectations of the public. When the health authority issues a permit to a food establishment, the public reasonably expects that the facility is regularly inspected to ensure that it meets safety and sanitation standards. People assume that the food served in permitted establishments have been prepared in commercial kitchens, not in unpermitted home kitchens. Under current law, when food is not subject to inspection, such as cottage food or farm to fork events, the public is required to be notified. Without such notification, the public would not be aware that the food from uninspected kitchens is being sold to them, and that prevents them from making informed decisions about the safety of their food. Thank you for your time.
Good afternoon, Chair Brown, May, and Committee. My name is Nikki Burns Savage, NIKKI-BURNS-SAVAGE. I am an Environmental Health Supervisor at the Southern Nevada Health District. I'm going to briefly explain our opposition to skipping the plan review process as outlined in Section 13, subsection D1, which would allow sidewalk vendors using non-stationary conveyances to bypass established plan review requirements. SNHD opposes allowing operators to skip the critical step of plan review. The process is not just a bureaucratic hurdle. It is a public health safeguard. Plan review ensures that food equipment is properly constructed, that layouts support safe food handling, and that operations meet minimum sanitation standards before a permit is issued. Also, during the plan review process, the owner-operator's food safety knowledge is assessed. Without the plan review step, we cannot adequately assess whether the vendor can operate safely. Our agency cannot issue a health permit without reviewing and approving plans, menus, or assessing food safety knowledge. While we can offer examples of approvable carts and sample menus to help guide applicants, these resources are meant to assist, not replace, the plan review process. That said, we are supportive of creating a model for an expedited plan review process for vendors using standardized design and menus, along with the assessment of operators' food safety knowledge. This balances the need for flexibility and efficiency with our responsibility to ensure public health and food safety. Bypassing plan review altogether, however, puts the public at risk and undermines the integrity of our food safety system. We respectfully urge you to maintain this essential step in the permitting process. Thank you.
Thank you. Seeing no additional support in Las Vegas, we'll move to the telephone line. AVH, is there anyone on the telephone line who would like to offer testimony in support of Senate Bill 295? Sorry, opposition. Sorry, opposition.
Thank you, Chair. If you would like to testify in opposition to Senate Bill 295, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 295, please press star 9 now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral on Senate Bill 295? Please come forward, both here in Carson City and in Las Vegas. Go ahead.
Thank you, Chair and members of the committee. My name is Peter Saba, Senior Government Affairs Manager for the Nevada Restaurant Association, spelled S-A-B as in Bravo A. We appreciate the work Senator Dunyate has done with us to amend SB 295 and address the Restaurants Association's concerns related to food safety, limiting allowable dairy products to shelf-stable items and requiring food handler cards for food vendors. Preparing food on carts are important improvements. We also support the inclusion of provisions allowing for the seizure and destruction of prohibited food items and the seizure of conveyances, which we believe will help curb the rise of unregulated street vendors and large taco stands operating in close proximity to licensed restaurants. We're taking a neutral position on the bill as amended and will continue to monitor its implementation closely. Thank you.
Thank you. Seeing no one else here to offer testimony in neutral and no one in Las Vegas, ABH, is there anyone on the telephone line who would like to offer testimony in neutral on this measure?
If you would like to testify in neutral for Senate Bill 295, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral for Senate Bill 295, please press star 9 now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. Okay, we're getting a nod off with no closing comments. I want to defer to legal. Mr. Nouse has clarification on one of the questions earlier.
Thank you, Chair. Thank you. I appreciate the opportunity. And thinking about my answer, I realized I could have been a bit more precise with my language, and so I appreciate the opportunity. So as I stated, Section 6 applies to what is Section 13 of the bill, and Section 7 and 9. Those sections apply to only what is currently Clark and Washoe County. There are other sections of the bill, and those sections do apply to all local governments and local health districts, or local boards of health. Specifically, that would be Section 10, 11.5, the definition in Section 12, which is existing law, and Sections 14.3 and 14.7, which are also existing law. So the entire bill is not just about Clark and Washoe County, only sections 7, 9, and 13. Thank you, Chair.
Thank you for that clarification. We appreciate that and getting it on the record. Now, deferring to our bill sponsor, any closing comments? No, we're good. Okay, thank you. With that, we will officially close the bill hearing for Senate Bill 295. Thank you so much, Senator, for being with us today. And we will open the bill hearing for Senate Bill 408. We will invite our bill sponsor forward. Thank you.
Good afternoon, Madam Chair Brown-May and committee members. My name is Shauna Tello, for the record, SHANATELLO. I'm the Academic and External Affairs Administrator for University Medical Center. I'm here testifying for Senate Bill 408 on behalf of UMC. UMC has served the people of Southern Nevada for more than 94 years, growing alongside Las Vegas to become the state's most sophisticated healthcare system and a vital asset during our community's greatest times of need. UMC has never lost sight of its mission to deliver the state's highest level of care to all patients, regardless of their insurance or their ability to pay. UMC is uniquely positioned as a nonprofit public hospital offering advanced care that isn't available anywhere else in Nevada, including the state's only Level 1 trauma center, verified burn center, and transplant center. As a result, UMC cares for many of Southern Nevada's most critically ill and injured patients. University Medical Center is pleased to present Senate Bill 408 in collaboration with Clark County and the state, and is proud to open the first crisis stabilization center in Southern Nevada with 24/7 access. This crisis stabilization center will allow UMC to continue serving the community's needs by treating individuals experiencing a mental and behavioral health crisis and decompressing the emergency department by ensuring the appropriate levels of care are being provided. The Crisis Stabilization Center will assist individuals with stabilization, community resources, medication, and other discharge-related follow-up items. The goal of SB 408 is to clarify UMC's ability to provide the additional services needed, such as medical detox, counseling, intensive outpatient therapy, and this is all part of the continuum of care for these patients. SB 408 will give UMC the authority to provide these services through a separate organization or a provider number where needed, which will have a profound impact on the community as we care for these individuals in crisis. The next section of this legislation involves modernization of language in relation to the employment of interns. So UMC currently has the authority under the law to employ physicians, dentists, and interns. This revision is just merely simply a modernization of the word intern to residents and fellows. Lastly, UMC remains committed to building upon its legacy and elevating the level of care available in Southern Nevada. And I just want to thank you all for your indulgence, and I'm available for any questions. Thank you.
Thank you for your presentation. Members, questions? Okay. Assemblymember Nadeem. Thank you. Go ahead.
Thank you for your presentation. So my question is how the separate mental and behavior and the crisis stabilization center is going to help the hospital and the patients?
Madam Chair, through you and to you, Assemblymember Nadeem. So essentially, right now, these mental and behavioral health patients have many co-occurring issues. When they present to the emergency room, many times there's not really a strictly medical need. They really need the mental and behavioral health assessment and substance use treatment. When these patients appear at the Crisis Stabilization Center, we will have physicians there that will do medical clearance and screening on those patients. And so this will in turn help decompress our emergency department to allow us to take care of those patients that have strokes and heart attacks and all those kind of other acute illnesses that we need to be able to treat.
Thank you so much.
You're welcome.
No. Okay. Good. Okay. No other questions. Thank you so much for your presentation. Okay, we'll ask you to go ahead and step back.
Thank you.
Thank you. We will now open up testimony in support of Senate Bill 408. If you would like to offer testimony in support of this measure, please come forward here in Carson City as well as in Las Vegas. Please take your time. You're not playing softball tonight, I take it? No? Okay.
Good afternoon, Chair Brown May and members of the committee. My name is Jeff Rogan, Jeffrogan, and I am here on behalf of Clark County. As you heard from Ms. Tello, Clark County and UMC are partnering on important and upcoming services for the community, such as the Crisis Stabilization Center that was referenced in the testimony and is in part of Section 4 of this bill. So Clark County, in addition to UMC, is in support, and we urge your support as well. Thank you.
Thank you. And quick healing wish for you. Seeing no one in Las Vegas wishing to offer testimony in support, AVH, is there anyone on the telephone line who would like to offer testimony in support of Senate Bill 408?
If you would like to testify in support of Senate Bill 408, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 408, please press star 9 now. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you'd like to offer testimony in opposition of this measure, please come forward in Carson City or Las Vegas. Seeing no one, AVH, is there anyone on the telephone line who would like to offer testimony in opposition?
If you would like to testify in opposition to Senate Bill 408, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 408, please press star 9 now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If there's anyone here who would like to offer testimony in neutral, please come forward now. No movement. AVH, anyone on the telephone line who would like to offer testimony in neutral on this measure?
If you would like to testify in neutral for Senate Bill 408, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral for Senate Bill 408, please press star 9 now. Chair, there are no callers wishing to testify neutral at this time.
Thank you, AVH. You're welcome to make closing comments, Ms. Tella. Thank you. We're getting a wave off. No closing comments. We will officially close the bill hearing for Senate Bill 408. Thank you so much for being here and your patience this afternoon. That leads us to the last item on our agenda, members, which is public comment. If there's anyone who would like to offer public comment, please come forward here in Carson City or Las Vegas. If you want to make public comment on the telephone line, it's 888-475-4499. Today's meeting ID is 823-008-03315, and then press the pound sign. AVH, is there anyone on the telephone line who would like to offer public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue. Again, if you would like to provide public comment, please press star 9 now. Chair, there are no callers wishing to provide public comment at this time.
Thank you, AVH. Members, that officially concludes our business for today. I hope to see you all at the softball game this evening. This meeting is adjourned.